Good evening, everyone. There are any number of fresh signs this country's weak and uneven response to the COVID pandemic is falling apart at the seams. Daily infections up, hospital admissions up, and deaths up too, with officials across the country meeting the moment of national crisis in strikingly different ways. Florida, where masks are not required, seeing some of the worst days any state has seen in this pandemic. While here in California tonight, also facing out-of-control infections, the governor has just reimposed statewide restrictions on everything from gyms and salons to restaurants and churches. A lot of moving parts to cover tonight. Let's start in epicenter Florida with Kerry Sanders.
In California tonight, an about face. What had reopened now closing again. The statewide mandate includes closing all bars and indoor establishments like restaurants after more than 60,000 new cases statewide in the past week. In 80% of the states, gyms and hair salons also ordered to again shut down. Some business owners say a second shutdown will close them forever.
A lot of really good people are going to lose their livelihoods and go bankrupt and Lord knows what, because people wouldn't wear a mask.
In Florida, which remains open for business, anxious residents, some without symptoms, began lining up at 1:30 this morning to get tested for COVID.
Have the line moving, please.
Florida now the poster child for what's gone wrong. More than 12,000 positive tests reported here today. This after Florida broke the single-day record in any state on Sunday, 15,300 positive tests.
And you're here because?
I want to test myself. They broke the record. I seen all the 15,000 and now, it's freaking me out.
The unabated increase over the last 2 weeks spreading in most of the country.
We keep looking for this reason why we have this high contagion. The reason is us, okay? There's no boogeyman, it's us. Unless we change behavior, we can do all the tests in the world you want, you can get all the contact tracers in the world you want, it's not going to make a difference.
Behind the statistics, the faces of those who thought they were too young to get sick. 42-year-old John Place on a ventilator after his 21-year-old son came home from a friend's house where he'd taken off his mask. The entire family now testing positive.
I feel like I'm living a nightmare, like it's a bad dream and I can't get up from it.
Doctors say they're increasingly seeing younger patients who tempted fate, attending so-called COVID parties where they intentionally tried to get the virus or prove that it's fake. In San Antonio, a 30-year-old who attended one of those parties died.
Just before the patient died, they looked at their nurse and they said, "I think I made a mistake. I thought this was a hoax, but it's not."
Tonight, a deadly virus continuing to spread as health officials urge caution while trying to ease fears. Kerry Sanders, NBC News.
I'm Miguel Almaguer. Tonight across the nation, healthcare workers are sounding the alarm once again.
Our hospitals are overwhelmed. We have 7 hospitals that are at maximum capacity right now in Miami-Dade alone.
With hundreds of Americans dying every day from COVID complications.
We see a lot of patients, and they're both young and old, that are getting very sick.
The surge in cases is flooding hospitals in hotspots like Phoenix.
We're at over 100% capacity, if that's possible. But every place there's a potential bed, we have a person.
In Arizona, nearly 1 in 5 are testing positive for the virus. In Texas, where the death toll is climbing, the scene is just as grim.
You see these warehouses of people on life support machines. It's dire when you're counting how many ventilators you have left. Do you have 2 left? Do you have 6 left? That's dire.
Their warnings reminiscent of those we heard from doctors and nurses in New York months ago during their darkest days. The CDC estimates nearly 100,000 healthcare workers have contracted COVID, with the death toll at roughly 800.
Every healthcare worker is working nonstop. Our workforce is also falling sick.
As California begins to close in on New York's record number of COVID cases, some hospitals do have room for new patients. But hard-hit regions like Los Angeles are in trouble.
It's exhausting and a little demoralizing.
After another grueling overnight shift, Nurse Jenny Wong Swanson says healthcare workers are tired and frustrated.
It does feel like it's out of control. I've never been in the situation in my career where somebody died because we didn't have enough resources.
Tonight, the grim reality on the front lines of a fight far from over. Miguel Almaguer, NBC News, Los Angeles.
So what's going on with the testing? In this fight to contain the virus, there's growing frustration over testing backlogs, people who may be infected waiting for tests and results, while some athletes apparently get easy access. Gabe Gutierrez now with that part of the story.
From Florida to California, Texas to Arizona, testing troubles are increasingly bogging down the nation's coronavirus response.
Delays in testing and inadequate testing are making people sicker, are making the outbreaks bigger, and are leading to more deaths.
The Trump administration has blamed some testing problems on mismanagement at the state level and says the U.S. did more than 800,000 tests on Friday.
We test more than anybody by far, and when you test, you create cases.
But today, the president's former chief of staff wrote an op-ed for CNBC. I know it isn't popular to talk about in some Republican circles, but we still have a testing problem in this country. My son was tested recently. We had to wait 5 to 7 days for results. That is simply inexcusable at this point in the pandemic. In North Carolina, Hugh Huffstutler was tested, then isolated in his bedroom in limbo.
It's insane to me that it still takes up to 2 weeks, 7 days, who knows, in order for these results to come back.
Public health officials say skyrocketing demand is creating a shortage of testing supplies, such as swabs and reagents, the chemicals needed to conduct the tests. The delays, critics say, are making an army of contact tracers paid for by taxpayers essentially useless.
Frankly, when you have a state like Florida that's on fire like this, contact tracing almost becomes irrelevant. It can't be done. It's kind of like trying to plant your petunias in the middle of a hurricane.
And in Florida, there's mounting frustration that while ordinary patients wait in long lines, athletes are getting tested frequently. One NBA player posting on social media that he's been tested 20 times since arriving in Orlando for the season. Now the race is on to develop quicker methods. At Arizona State University, researchers are aiming to conduct 16,000 tests a day, up from 2,000, by analyzing saliva. Here in New York City, some patients are waiting more than a week for their test results. The mayor here is urging the federal government to invoke the Defense Production Act to expand lab capacity. Lester?
Yeah, something we can't afford to get wrong. All right, Gabe, thank you. The government's most prominent medical voice in this crisis, Dr. Anthony Fauci, finds himself increasingly at odds with the Trump administration tonight and a target as he becomes more blunt about what we face and the response. Our Jeff Bennett is at the White House.
Tonight, Dr. Anthony Fauci under fire from within. The nation's top infectious disease expert targeted by a White House effort to discredit him and his dire warnings about the coronavirus crisis. A White House official on Sunday sent NBC News and other outlets a list of Fauci's past statements on the virus, said to be inaccurate, the memo resembling a campaign opposition research document. Some of Fauci's comments taken out of context, others accurate based on what was known about the virus at the time. It's a stunning broadside against a career civil servant who's advised 6 presidents and was awarded the Presidential Medal of Freedom. President Trump today downplaying the rift.
I have a very good relationship with Dr. Fauci. I've had for a long time, right from the beginning. I find him to be a very nice person. I don't always agree with him.
Fauci no longer briefs the president and hasn't spoken to him in more than a month. In recent weeks, Fauci has become increasingly vocal about the country's coronavirus response.
As a country, when you compare us to other countries, I don't think you can say we're doing great. I mean, we're just not.
Well, I think we are in a good place. I disagree with him.
Dr. Fauci's a nice man, but he's made a lot of mistakes.
A recent opinion poll shows the American public trusts Fauci's advice over the president's when it comes to the pandemic. The White House had sidelined Fauci from coronavirus task force briefings and interviews as it pushes President Trump's call to reopen the country. An effort that continued today with the president retweeting a baseless claim by a former game show host that everyone is lying about the coronavirus, including the CDC. Dr. Fauci is declining to comment, but he weighed in today about the new surge in coronavirus cases. Fauci saying of the pandemic, "We haven't even begun to see the end of it yet." Lester?
All right, Jeff Bennett tonight, thank you. And in the midst of the pandemic and the politics, a real practical concern tonight for families. What will the school year look like? As Stephanie Goss reports, some of the country's biggest districts are now weighing in.
On August 18th, the first day of school in Los Angeles, students will be learning from home.
The health and safety of all in the school community is not something we can compromise.
New York City schools may not open either. The governor saying it will depend on the data.
It's not do we reopen or not. You reopen if it is safe to reopen.
For now, the country's largest school district has not met the reopening requirements set by the state. And in Florida's Miami-Dade County, nearly the same message if the numbers don't get better.
It would be very difficult for us to reopen schools.
While President Trump continues to support reopening this fall.
We have to open the schools. We have to get them open. And I think there's a lot of politics going along.
The Trump administration is not issuing any national guidelines to reopen, distancing itself from those proposed by the CDC and the American Academy of Pediatrics. Over the weekend, Education Secretary Betsy DeVos said the decisions should be made on the local level.
Schools should do what's right on the ground at that time for their students and for their situation. There is no one uniform approach that we can take or should take nationwide.
Among the considerations will be growing research that children are less likely to contract and spread coronavirus than adults. But many are worried about schools reopening in hotspots. In Arizona, 3 teachers who shared a classroom to teach summer school students online all contracted COVID despite following CDC guidelines. One of them, a longtime educator, died. And some students are concerned, too. In Virginia, high school senior Sophia Baraban says she doesn't want to go back.
Just going to school right now feels like such an experiment. And, you know, me, my peers, my family, and my younger siblings we're not willing to be part of that experiment.
The other goal, say some educators, is to try to limit the disruption as much as possible. The last thing they want to do is reopen schools only to have to shut them down again. Lester, nothing about this decision is easy.
You've got that right, Stephanie. Thank you. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.